Hey folks, welcome back. I know you missed me. This just in, got my Florida medical license, so I'm officially a doctor now. But today it's story time. I got confessions of an intern. I'm gonna tell you how a nurse saved my job and made me look good. Okay? So I started surgical residency. I transferred surgical residency October 22nd. That was my first day. All right. It was a general surgery trauma rotation. 1 month in, it was a 2 month long rotation for me. 1 month in, I got feedback. Okay, this feedback bummed me out like crazy. Here's the feedback. You hit the floor running, you're a good team player, you communicate well, but you still don't know how the OR runs, you don't know about patient positioning, you don't know what the next step is, etc., etc. Well, in my mind, I was like, no shit, I just started a month ago in surgery. So there's an expectation that I'm not going to be up to speed with the surgical residents. So either way, I was bummed out, and I was needing to prove myself because application rec letters were due, stuff like that. I wanted my program director to reach out to me. So I was at a semi low point, okay, and it was time to grind, time to hustle. All right. So now I got some context for you. I'll tell you some characters. So first of all, my chief had already been accepted to a trauma fellowship, Yale grad, super competent, super intelligent, PGY 7, did 2 years of research, knows everything about everything. Okay? The other character in the story is the competent nurse. All right? And then there's me, obviously, naive, wide eyed intern. Then there's a patient, 55-year-old female with a history of a slipped disc and a fractured vertebrae, CMV colitis, okay, and then pain, unknown pain, all right. Because of this pain from her back, from the vertebra, and some other abdominal pain, she was on chronic opioids, all right. So she was opioid tolerant, as you would say. So here's the story, all right. I get a message from a nurse, happens to be a she, and she says to me, there's this patient, her abdominal exam just isn't right. Can you come see her? Okay. This was like 2 days after I got in that feedback session, by the way. But that doesn't mean that I suddenly tried to be a better doctor because of the feedback session, but it just giving you context of how it helped me so much, how it came at such an opportune time. So let me just tell you another thing that I learned, as in my first few months of residency and even in med school is, do you think like you're a glorified med student when you're 2 months into residency? Do you think you know more than a nurse who has like 5 years experience or 10 years experience? Probably not. The other thing is, clinically, they're there to see the changes in real time, whereas you only get a snapshot. You round in the morning, you round in the afternoon, and then you come to the patient's bedside when you're called or when you feel like there's something that needs to be seen. Now there is a lot of information that you get from that snapshot of time, and there's a book called Blink by Malcolm Gladwell. I'll put a link in the description, which you should read, which really elucidates how well we can gather knowledge in a snapshot. But anyways, the nurse is there, the entire 12-hour shift. Okay, nurse has clinical experience more than an intern, more than an intern who's had 2 months of training, and that's why I don't ignore the nurses when they say something. But anyways, nurse calls me over, so I show up. All right, to this patient. They're at 5 North, bed 507. Okay, I go over there. She's like, her abdominal exam just doesn't look right. She has a lot of pain, and I'm giving her pain medication. It's not touching her. So I say, of course, I don't have any information to dispute this nurse. So I say, show me. Why? Because I don't know what I'm doing. Okay. And you don't either if you're 1 month into residency right now. So she percusses her belly, she presses on her, she does some deep palpation, and this patient's in pain for sure. Okay. So, I kind of repeat the same exam, and I'm like, man, what kind of medication? She just got morphine, just got Oxycodone like 5 minutes ago, IV, nothing's touching it. Okay. She has a history of CMV colitis, but she also has a history of the vertebrae thing, and that's why maybe she's opioid naive, opioid tolerant. But I was like, oh, something's up. Okay. So what do? I said I thought something's up. Like this is a surgical abdomen, is what I thought, based on the nurse's description and her leading me towards that conclusion. Okay. I remember I pressed on this lady's belly. She was withering in pain. So, of course, like, you gotta remember, I don't know what I'm doing. Okay. So, anyways, I call my chief. I don't call the OR, I don't page, I don't do no message on Teams or whatever. I call my chief's cell phone directly, okay? And I was like I was like gonna pull him out of the OR basically is what I was willing to do. He picks up, he happens to not be scrubbed. And I said, hey, I'm in room 507 in 5 North. This is made up. These numbers are made up, by the way. And I need you to come because there's this lady who I think needs to go to the OR. Okay? And then I say, I'm going to order a CBC, a VBG with lactate, a KUB, an upright chest x-ray, and then probably we need to scan her. All right? So he's like, I'll be right there. Probably 1 minute later, he's there, and I'm putting in the orders, and he's like, what's up? And I show him. What do I show him? What I just learned from the nurse, okay? He repeats the exam. He's like, you're right, okay? Let's call rapid. We'll call radiology. We'll get it to the scanner, okay? So we got the chest X-ray. We get the chest X-ray, the KUB, the labs are drawn. And then she goes, and there's no free air in her belly, which was our suspicion, or my suspicion, based on, again, what I learned from the nurse and somewhat from med school. And then she goes to the scanner, okay? And then he turns to me and he asks, what made you come? What made you examine the patient like right now? Like why, So I looked at him dead in the eye and I said, clinical suspicion. Okay. And from that point on, that's it. I had made it. I was no longer the new guy. Okay. I no longer had to prove myself as much. Okay, he just looked at me, he approved, he nodded, gave me his approval, and then moved on. She was scanned, she turned out to have mesenteric ischemia. She went to the OR. Here's another big point that I have to make. This all started around 4 p.m. My shift ended at 5:30. When she went to the OR, I handed her off to him in the OR at 5:30, and I said, I'm going to sign out to the night team. I didn't stay late, okay? And he said, okay. He said, go home. I didn't stay late. So what's the lesson here? I'm telling you how a nurse saved my job. Nurses are very helpful if you utilize them properly. If you're not some arrogant intern coming in thinking you're a doctor because you have 2 months of residency under your belt, okay? The other thing is, just because you're going to help someone doesn't mean you have to sacrifice your own mental health and your own leisure time and your time with your family, all right? There's a handoff system. You need to use it. And then the third thing is, communication is critical when you don't know what you're doing. You have to ask. I asked the nurse, show me, and she taught me. I called my chief. I told him what I felt, Now, you can't be so naive and tell your chief, by the way, I have no idea what I'm doing, even though you feel that way. Because you do have some idea. Okay. But you have to, if you want to get ahead, you got to take all the gains you can get. And again, like I said in my previous videos, never lied, was never unreliable, no character flaws. Single character flaw, you're out. No one's going to want to hire you. No one's going to want to work with you. Ignorance, though, or not knowing what to do next, no one's going to fault you for that. So it's August. You guys have been interns for a month now. This is just a lesson of how you can get a little ahead, how you can do the right thing for your patient, respect your nurses, try to learn from them as much as you can.